Hello, it's a pleasure to introduce a new chapter in the PCR EAPCI textbook. It is entitled Use of Ultra-Low Contrast Techniques in Percutaneous Coronary Interventions. As interventionalists, we've been trained in performing interventions or performing a PCI in vessels that have to be opacified with contrast. This is rooted, of course, in the only way that was available at the time of Andreas Grunstig to visualize the coronary vessels, the coronary angiogram. Things have changed over the more than 40 years elapsed since the inception of PCI. Now we have multiple techniques that allow us to image the coronary vessels and to perform interventions without the need of contrast opacification. Over this time, patients have also changed a lot. The patients that we treat nowadays in the cath lab are patients that have multiple comorbidities and patients who, in many occasions, restriction of use of contrast may contribute to improve the safety of the intervention or even the quality of the intervention. I'm thinking not only in patients who have chronic kidney disease, but patients in whom, given the complexity of the case and that required a long procedure, a use of liberal use of contrast may contribute to having to stage the intervention. So in this chapter, we will have an approach to ultra-low contrast PCI as a way of improving the safety and improving the quality of coronary interventions. You will see that there are multiple scenarios in clinical practice where competence in these particular skills and knowledge on the specific tools that you can use to perform PCI without contrast can be very useful in achieving a better result of your intervention. Of course, this requires a major change in mindset. We've been trained to use contrast to perform our interventions. We typically engage in performing more injections when we are in a difficult situation like a iatrogenic dissection or a complication. And we have to reset all this, and hopefully this chapter will tell you how to get initiated into a way of performing interventions without contrast opacification. You will learn multiple tricks that can be performed in your cath lab using what it is already available, but also you will learn about the use of more sophisticated approaches, like, for example, co-registration of IBUs with the wire silhouette without performing injections, use of pre-existing material like previous angiograms or CT angiograms that can be analyzed to prepare your case, or also the use of diluted contrast to perform selective injections while reducing the total amount of iodinated contrast administered to the patient. So we hope that this chapter will stimulate you in joining this particular type of interventions. We believe that at the time of performing complex PCI in complex patients, this is an indispensable part of the toolbox that every interventional cardiologist should have.